Good afternoon, and welcome to today's Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Improving Our System Together monthly webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call unless you are speaking or asking questions. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. We will answer as many questions as time allows after the presentation. The American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Steelman-Bridges and Susan King Lanier. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions, weathering the storm, and the NCDHHS ongoing Hurricane Helene response. We will hear from our LME MCOs and discuss MHSU IDD TBI resources. If there is time, we will also have a question and answer session. At this time, I'd like to turn it over to Kelly Crosby, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Hello, everyone. Thank you so much for joining us today. And as you'll have noted, we're not going to have our regularly scheduled topic today for Side by Side. We wanted to take a moment first just to check in with the community. It's important that we check in with one another. Second, to talk about some of the things that the department is doing. We want to make sure that you're well aware of our priorities right now during the Helene response. We're still in response phase. We have our wonderful partners, the LME MCOs, here today, and you're going to hear from Tracy Hayes at VIA and Rachel Porter at Partners with all the work they're doing locally. So we just wanted to really, again, just connect with y'all, make sure that you know about the resources that are available to you, the actions that we are taking, and we just thought it was really important to connect with y'all. So that's me. For those of you that don't know me, it's good to meet you. Kelly Crosby here. I'm going to ask them to turn on their cameras right quick. We have here Tracy Hayes, who's the CEO of VIA. Always happy to see Tracy. We can't, we have Tracy, make sure Tracy can turn her video on. We've got Rachel Porter, who's the Deputy CEO of Partners. There's Tracy. Rob Robinson, the CEO of Alliance Health, and Joy Futrell, the CEO of Trillium Health Resources. So I have to say, the LME MCOs have been living up to and beyond expectations the past couple of weeks. Just wonderful, wonderful group of partners to work with locally. We meet every day. And it's great to know that we have such a community who's really, really supporting the West right now. So thank you all for being here with us today. Like I said, Tracy and Rachel are going to give some local updates a little bit later in the webinar. All right, next slide, please. So let's talk a little bit about weathering the storm. We borrowed this wonderful term from our partners over at Trillium, who, I hate to say this, but I want to compliment their efforts, their frequent efforts at helping folks manage hurricanes and other natural disasters. And we really think it's a very fitting term. So if you go to the next slide, you'll be seeing very soon, we've already published some materials and we'll be publishing more materials. We're still in response right now, but as we move into recovery, we're going to be talking about that term, weathering the storm some more. I want to remind folks, because we're going to do a deep dive, of course, we're going to do a deep dive on mental health, substance use, IDD, TBI resources. That's what we'll do a deep dive on. But I want to do some high-level reminders right now. Please remember, call 911 for emergencies and call 211 for local resources. You know that already, but we just want to make sure we're getting those messages out there. And again, we're all wearing different hats on these calls, right? Very, very different hats. Many of us have friends, family, colleagues out in the West that we're concerned about. Many of us are here as providers or professionals. Some people from the West are able to join us as internet and phone comes live, and we're so glad that they're here. So we're all wearing different hats right now, and we want to make sure that we are talking about resources across the board. But certainly for folks locally, folks in affected counties in the West, 911 and 211 are definitely those emergency management resources we want you to use. For those that do have internet, there are several available websites that we wanted to make you aware of. There's lots of websites out there right now, and you go to the one that's most comfortable for you. But we're advertising readync.gov. It does have a list of available shelters and other resources. We want folks to work with their community emergency management system. So that link there will take you to a list of all the county numbers that you can call county emergency management. We also publish the hot topic, and I understand the things I'm saying are dependent on someone having the internet. I appreciate that. But we published all the local numbers for all the county emergency management in affected counties, so you just have those direct phone numbers. And we want to make sure people know the FEMA number. I understand forms and are not easy nor fun to fill out, but we already know that FEMA has given out hundreds of thousands, if not millions of dollars in recovery dollars already. So that's the website for FEMA disaster recovery. We just want to make sure folks know that. You might not be in a space right now to be looking at some of those things, but some of them you might be. And I know that's a span, right? We got emergency services up here on the other end of the spectrum is I'm ready to apply for FEMA. We just want to make sure that folks know those big, broad resources are available. And we're always ready to listen and help where we can. Can't fix everything, but where we can for when these things might not be working. We're always here. We're going to talk about some of our community-specific resources. All right, next slide, please. Now here's, again, some more specific resources for our community. I want to say our community, that's folks with mental health, substance use, IDD, TBI needs, but really our community is the whole state, right? Everyone needs services sometimes, especially now more than ever, right? So I want to remind folks that 988 is there. The Pure Warm line is there at 1855 Pierce NC. We launched the Hope for NC line, or relaunched the line at the end of last week. That specifically calls for helpers, volunteers, first responders, shelter workers. We just want to make sure that our helpers have a place, a very specific and dedicated place to call. DHHS, I'll show you the website in a moment, has set up the Hurricane Helene recovery resources. And of course, we're working very closely with the Department of Public Safety, of course, and we wanted to show you their website as well. On the right, you're going to see a flyer that we sent out in Hot Topics that will be posted on our website probably tomorrow. This is an English and a Spanish version of just reminding the community of some resources. Because, and you'll hear me say this many times, there's no right or wrong way to feel right now. There isn't. We're talking to everybody, and all the feelings are out there, right? Some people are in shock. Some people are grief-stricken and full of loss. Some people are angry. Some people are quite depressed and despondent. Some people feel guilty because they were spared and their neighbors weren't. Some people are just incredibly anxious. I hear anxious more than anything. We're anxious about friends, loved ones, and what the future is going to be like, because for some people it will be different than what they were expecting it to be. There's no right or wrong way to feel. We just want to reassure folks that in a disaster like this, there will be lots of big feelings, and you may not feel them today, and how you feel today might be different than how you feel tomorrow. I want people to know no right or wrong way. Please reach out to resources. This is the first flyer that we got out, which is just some really crisp resources: 988, the Pure Warm line, the disaster line, and we wanted to make sure that people knew about some basic mental health and substance use resources in the community. Now on the next slide, you're going to see, as I mentioned, the department's Helene Recovery Resources webpage. Again, this, hopefully folks are getting internet up and running. I understand for some right now that's not a reality, but for many of us it is, and there are tools there we can use to help others. There's everything from emergency management requests to FEMA requests to telling folks about open shelters, where to volunteer, how to get additional help. So please use that website. We try to keep it as up to date as absolutely possible. Next slide, please. You will soon start to see flyers coming out from us called Weathering the Storm. Again, we really want to make sure that people are paying attention to themselves and caring for themselves right now. We're going to be encouraging people to connect with one another. Like today, we wanted to connect with you. So again, whatever county you're in, especially in affected counties, but all the rest of the counties too, right? Connect with others. That's good for you and it's good for them. Share your feelings. I'm a feelings person. I'm a social worker. You know that about me, right? But we all need to right now. And we all share our feelings in different ways, but it's good as much as possible to be attuned to those and to find a person that you feel comfortable sharing it with, right? Or maybe it's your pet. Whoever it is, maybe it's 98 because you prefer the anonymity. That's fine. Just be able to connect with and share your feelings. Stay informed as much as possible. And I don't mean doom scrolling, right? There's a lot of misinformation, a lot of scary news out there right now. There's also a lot of empowering information. There really is. And you might be in a place where you are in a better place to help someone else right now with information. So stay informed. I'm so excited and grateful for all the organizations that are on this call today that are putting out information for their members and their providers and their consumers. Thank you for doing that. Let's share good, helpful information with one another. For those of you that are helping, take some breaks. Over this weekend, I've got a thread with the CEOs, I've got a thread with my staff who are working on disaster response, and we're all telling one another to take a break, just to take some time, recharge, right? It's important to think about recharging and taking some time for self-care right now, and ask for help if you need it. On the bottom, all the good clinicians will just see these signs. Please pay attention to yourself, to your loved ones, to your friends, to your colleagues. If you see signs where you might need to suggest to that person or yourself that you need some extra help, right? And those are the classic signs that it's normal to feel however you're feeling right now. Hear what I said? It's normal to feel however you're feeling. It's normal. There's not a wrong way to feel right now. Very normal to feel sad and anxious. But remember, if those feelings become overwhelming, they become debilitating, they affect your daily life, your ability to function, your ability to sleep, your appetite, your interactions with others. That's maybe when your feelings are getting very intense, and perhaps you could use some professional support. That's why we want to encourage you to call 988 in the Pure Warm line if it gets to a place. And please notice it in others and ask. I just love my team. You know, they come by my office all the time and they say, "How you doing, Kelly?" And they mean it. They mean it for real. And I appreciate that. So be that for each other. Ask how people are doing. Pay attention. Next slide, please. Let's talk about DHHS ongoing Hurricane Helene response. This is a lot of weedy details. I'm not going to go through everything in detail, but I want you to understand, because I think it's important for you to understand the things that as a whole department we're focused on, not just DMH, DDSUS, right? Medicaid, public health, DSS, aging and adult services, DCFW, DHSR, DSOF, right? All of Health and Human Services. We're focused on a lot of really critical things right now as we are in disaster response. So I'm going to walk through those. Next slide, please. First, we're making sure that our healthcare facilities are up and running for everyone. So we know the status of all the acute hospitals. They all have power. We're paying attention to nursing homes and assisted living facilities. That means contacting them all, finding out the state of their electricity and water, and having an orderly process for moving residents if we need to. Mission Hospital, which is the only trauma center in the region, is open and ready to support. We're also, of course, managing our 4 state-operated healthcare facilities. And all the members there, all the people getting services are accounted for. We've had to move some people, but everyone is safe and accounted for. And moving people was because of no access to electricity and water. So making sure that our highest level of care, our hospitals, our nursing homes, and our assisted living facilities that have some of the most vulnerable people, medically complex people, are running and okay. Next slide. We are also making sure that people have access to community medical services. So in each of the 25 affected counties and the Eastern Band of Cherokee Indians region, we have at least one pharmacy open and filling prescriptions. The primary provider of dialysis in the affected region is open at almost all sites and is offering care. We have standing order for EpiPens and other emergency medications. That's a standing order, so you don't have to get something from your physician, right? State Health Director Betsy Tilson gave a standing order, so folks can go get those things. We're fulfilling requests for oxygen in healthcare facilities and shelters. Pharmacists can give out emergency medications. We know sometimes that's very important for our community, right? We can get our medications, antipsychotics, antidepressants. Offices can get Suboxone, so we can get emergency prescriptions for people. And there, again, if you have access to a computer, there is a website that tells you where local and available pharmacies are. We're also paying attention and listening to places where we might need mobile pharmacy or even mobile medical clinics to go to areas. So stay tuned. We're very attuned to where we might need more of those. Next slide, please, or next slide. We're also proactively trying to account for, it's not a word I use a lot, vulnerable individuals, but again, individuals with very complex needs that we want to make sure who might be most adversely affected right now. So for us, and kudos to VIA and partners, they're reaching out to all innovations members, all members who are receiving transitions to community living, Money Follows the Person services, and our members who are in ACT teams. That's really critical. That's a lot of people. It's a lot of people, and that's a lot of outreach by people who care, making sure that those folks are accounted for and doing okay, identifying what their needs are and trying to help them meet those needs. We're also making sure that people who are on electricity dependent care, right? So you need some kind of electronically monitored something that's helping you survive, that's helping you medically. Those people have been identified, and there's proactive outreach to meet those individuals as well. VIA in particular and partners are calling all the group homes. So group homes, these are for adults. These are our licensed group homes or licensed AFLs, and all of our residential levels of care for children. So level 2, 3, 4, PRTF, just to find out the status of the facility and all the residents, just to make sure they're okay, identifying their needs. And in some cases, people will need to be rehoused. So they are cataloging all of that right now so we can rehouse people. Children in foster care, of course, are also in the affected region, of course. So DSS has been working tirelessly to identify all the children, all the foster homes, to make sure they're okay and their needs are met as well. So there's a lot of individual people contact. And again, kudos to the VIA and the partners team for that work. Next slide, please. There's obviously shelter and food assistance. The shelters change all the time as they reconfigure and to meet the needs of the community. Shelter numbers actually continue to go down as people get electricity and water, things like porta potties and food. Now we have 18 shelters. That is the live shelter list. We're working with USDA. Lots of food is being provided. We are working with the federal government on waivers for more people to get emergency food and also hot food on a routine basis. So a lot of that is actually going out, hot food, but we're working on all the waivers we need for more of that locally. And of course, and many of you have been involved in this, and it's so inspiring to see, we're making sure that we're working with distribution centers, with FEMA, with Red Cross, with public safety to make sure that food and water are being delivered to communities. Also things like formula, baby wipes, diapers, other things that people need are being delivered. Next slide, please. For mental health and substance use supports, we've been hyper-focused, and on all credit to Dee Dee, Smith, Anna, and Pam for working with all 27 of the opioid treatment programs in the affected areas. All 27 are open in some form or fashion, and they are all partnered with a shelter because we want people to be able to get their medications. We want to make sure that we are people aren't detoxing and having adverse effects from not having their medications. People can also receive guest dosing, so they can go to a different clinic than the one they normally go to. That's okay. All clinics are providing guest dosing as well. Again, if you have the internet, there's another live map of where all the opioid treatment programs are. We're also making sure that mental health resources in particular are available. Things like 988 and the Peer Warm Line. VIA and their provider network has done an amazing job of making sure that the mobile crisis providers are up and running. All of the walk-in mental health clinics are up and running, and I think that's astounding. So again, and VIA is doing a wonderful job of advertising where those sites and services are so local people know where they are. We're also preparing to deploy 8 mobile clinics to places in the state that are hardest hit and are having, obviously, it can be hard for people to get out to services. And those mobile clinics will not only have medical care, they'll also have mental health care. And again, this is one more place. There's so many places where the LMEs and providers are helping us to staff those mobile clinics. Next slide. For innovations in TBI, the Medicaid team has been so hard at work, working on current flexibilities for the waivers. There is a bulletin that was published with those flexibilities, and they are working right now too on things like things that we might have done during COVID, to use an example, Appendix K flexibilities, things like provider retainer payments. So the Medicaid agency is hard at work on waiver flexibility. The bulletin was published, but stay tuned for more information. There's the hot link to the bulletin. Some of the high level things, and I'll do high level, but relatives of adult waiver beneficiaries and minor waiver beneficiaries who reside in the home and out of the home may provide services. Relatives of adult waiver beneficiaries and minor waiver beneficiaries may provide community living support, supported employment, and supported living. And this would be in cases where direct care staff are not able to come because of the effects of Helene. Additional services hours may be provided without prior authorization if it is Hurricane Helene related, and that's why the beneficiary needs additional hours. Next slide, please. Their beneficiaries can get replacements or repairs of home and vehicle modifications due to damage by Hurricane Helene, even if it exceeds the Innovations waiver limit, which is cool. And Innovations waiver services may be provided out of state without prior authorization when a member is displaced and requires out of state sheltering. Now, these are some of the immediate waivers that the Medicaid team got out there. They're in a bulletin, read them all. But again, know that the team is getting lots of feedback and they're working very hard every day to work with CMS and to publish additional flexibilities. Next slide, please. On Saturday, Governor Cooper issued an executive order with Hurricane Helene flexibilities. Many of those you will remember from COVID. Probably the two biggest that we wanted to point out to you is that there is flexibility for out-of-state licensed providers to provide services. So if a provider has a social worker or a CADC from another state, they can provide services here. Same thing for pharmacy or medical care. But we wanted to make sure that we're allowing flexibility in care right now. Also, there has been bed flexibility. So bed capacity rules can be waived right now if we need to add additional beds to facilities or stand up, I'll say temporary units, just add additional beds to facilities. There's waivers for that right now. But remember, this is very much like a fluid process, right? Very on the ground. We needed to get some executive orders out immediately. We needed to get some waivers out immediately and know that we're continuing to work on additional flexibilities or executive orders or even law changes that we need. So many of you are sending in ideas, things that work during COVID or things that other states have done, and those are most welcome as we're trying to really rapidly get the flexibilities we need in place. Next slide. So we're going to hear from our LME MCOs, and as Tracy and Rachel, Tracy will go first. I want to show you this next slide. I think our LMEs did see it, so I don't mean to surprise them, but these are just some of the pictures. You will see, you'll recognize some folks in here. We've got VIA staff, we've got partner staff delivering things to VIA. We've got VIA with things that Trillium sent them. We've got VIA going out into the community. We've got Rob and Sean there from Alliance delivering supplies. It has been a really hard couple of weeks, and I can't imagine what it's been like for the VIA team and the community out in the West. But one of the most heartwarming and wonderful things has been how VIA is supporting their community with supplies and how partners and Alliance and Trillium are supporting VIA and the members at VIA with just all sorts of everything. Tracy would say, I need something. And Libby would say, okay, we're going to put it on a truck and get up there to you. So it's been a really wonderful experience and really proud and pleased to work with them all. I'm going to turn the microphone over to Tracy now. I really wanted y'all to, if you haven't seen Tracy, here she is. She's incredibly resilient and strong, as are the VIA team. And I wanted to give her the mic to have her talk about some of the things that VIA is doing on the ground right now. If we can advance the slide for Tracy, and then I'll turn the mic to Tracy.
All right, good afternoon, everyone. I hope everyone can hear me. It's really a privilege to be here with all of you today. I think what I want to start with is just, I so appreciate all the kind things that Kelly has shared about LME MCO response. But we are operating in the eye of the storm, and we are very keenly aware that we still have providers, members, staff still without power, significant damage to their homes, lost family, loved ones. And we are here to support everyone as to the best of our ability, but by no means do just because some of us are getting power back. I got my power back late last night. Doesn't mean that we have forgotten about all the people who are very much still struggling. So just wanted to start there. And I'm going to share with you all just a few of the highlights from VIA. So first I will just share, because this was a little bit of a stress point for us. It took us about 4 to 5 days to account for the whereabouts of all of our staff. We have 1,162 employees, many of whom live, all of whom live and work in the counties we serve, but we have many staff in some of the hardest hit communities, places like Swannanoa, places like Mitchell County and Yancey County, Burnsville, Spruce Pine, Ashe County, Avery County, Haywood, Hendersonville. We have staff in all of these counties who have been hard hit. So of course, one of our priorities was making sure to account for the whereabouts of all our staff. So huge relief when we were able to get in touch with that last person. Lots of gratitude to those across the state and at the department who were praying and supporting our staff from afar. So what I will tell you is that despite many of our staff having trees in their living rooms, being completely dislocated from their homes, living in hotels, every one of them has tried to take their laptop with them and is working from where they are. So our staff are really focused on the mission, they've been finding really creative and inspiring ways to support our communities. Initially, when none of us had internet, they were driving around to parking lots, trying to find a signal so that they could get on the phones and on email and try to start to account for members. So that has been our primary focus. The good news I can share with you is that all the preparation that we as an LME MCO are required to do for disaster planning worked. So our call center stayed operational throughout. We did not lose internet at our primary office because we have a backup internet system that kicked on. We of course have generators and things like that. So our behavioral health crisis line, which is 1-800 849-6127, continues to be available 24 hours a day, 7 days a week, 365 days a year. That line never went down. Our member and recipient service line also stayed operational throughout, 1-800-962-9003, and that's available Monday through Saturday, 7 a.m. to 6 p.m. All of our other service lines, our provider support line, our pharmacy line, our nurse line are fully operational. I don't want to repeat all the stuff Kelly said, so I will just say we are absolutely working with the department, the Red Cross, and local and state emergency officials to make sure that shelters are all staffed with behavioral health clinicians. I want to give a shout out to all the providers who are supporting us, in particular RHA, which is a big provider for us here in the western part of the state, ACS, Meridian, our FQHCs, Daymark. So many of the providers have really stepped up. Our mobile crisis management team stayed operational. I shared a story with Kelly that one of RHA's mobile crisis teams took a call from someone who was stranded on a roof. They were able to connect with the National Guard. The National Guard got out to that individual, and not only did they rescue that individual, they rescued somebody on a neighboring roof who was actually in labor. So just some really heartwarming stories and inspiring stories from our providers. We received word pretty quickly from Daymark that they were working on a plan to evacuate the 12 youth who were at the Kylan Burrell Child Crisis Facility, which of course is right in near Mission Health, right in the heart of Asheville, had lost power, water, etc. All of those youth were safely evacuated to another facility. So we are working primarily out of our Ridgefield office in Asheville. The vast majority of our offices are open to the public. The Burnsville office is not open to the public. And so we want to make sure folks know that. But our Burlington office, of course, our office out east in Vance County is open. Our McDowell office is open. Our Wilkes County office is open. So all of the VIA offices are open. Now the Ridgefield office, like most in Asheville, we do not have water here. So we were able to get some porta potties and we have bottled water. But if there is anybody who needs support, they can come to our Ridgefield office. We have about 1,180 total providers in the impacted counties. Let's see, we have actually been able to outreach over 800 of them and have connected with well over 700, and almost 600 providers are back up and operating. And that number continues to grow every day. And we can share the details on those numbers for anybody who is interested. In terms of outreach to members, I think, that has been a huge priority for us. And I don't want to repeat everything Kelly said. We are prioritizing individuals, of course, who rely on electricity for medical need, individuals on insulin, individuals who need critical medication. We are actually making personal deliveries of medication as needed, as we have identified individuals who can't get out of their homes to get to a shelter. We have outreached almost 2,000 members. We've made contact with well over 1,000, and we are just continuing to work to outreach members and escalate any urgent situations that we learn about to emergency management. Our office, Kelly shared some of those wonderful photos, could not be more appreciative of the help from Trillium, from partners, from Alliance, delivering supplies, giving, especially the folks at Trillium, giving us feedback about their experience with Hurricane Florence. And so our office here in Ridgefield is serving a little bit as a donation hub. And here's what we're doing with those donations. So partners delivered fuel to us. They brought 15 gas cans filled with gas. It was very challenging to get gas for a period of time here in this area. And we actually delivered that to providers for use for their generators so that they could keep some of their facilities going in places where they have residential facilities. So really tried to prioritize those residential providers, AFLs, group homes, therapeutic foster care, those providers that are caring for members in a home. Wanted to make sure that those folks continue to have power if they had a generator and had food and water. So we are delivering water and food to providers. We have made some personal deliveries to members where we have become aware of members, again, who are unable to get out of their home to get to a shelter. And we're just going to continue this work until we've accounted for every VIA member and for as long as we can. We're really prioritizing individuals who have an assigned care manager, of course, and those in the TCL and MFP programs. We also were able to get a truckload of over-the-counter medications and health supplies, things like insulin syringes from Medicis. So we're working to get those out to our communities. And of course, we have implemented all of the flexibilities that the department has enacted so that we can just be flexible and respond to needs. So for example, we have many members who have relocated outside of the state, have evacuated to places outside of the state. Those claims are getting paid. Even if those providers are not yet enrolled in NC Tracks, we didn't want a single member to lose access to a critical medication. So we've made sure that those pharmacy claims are getting paid, those essential healthcare services are getting paid, and we will figure it all out on the back end. And we are also working really hard to advocate for funding resources for the providers across our catchment area. We recognize that providers are going to need additional financial and funding assistance to support them through this terrible time. And so we are advocating with Kelly, with Secretary Kinsley, with legislators for funding to be able to support providers above and beyond claims. And then Kelly mentioned the mobile pharmacies and mobile healthcare units. We're really hopeful that those can get located in some of our hardest hit counties and get the help to them that they need. I will say, one of our concerns is around water. We have just so many folks right now without potable water, without safe running water. And so that's going to be a longer term challenge that we're going to have to support our providers to address. But in general, just so proud of all of our providers who have stepped up and the VIA staff. And please just know that our number one focus is on making sure that every member is safe, that they're in a safe location, that they have food, that they have water, that they have the medicines that they need. So with that, I will hand it over to Rachel Porter from Partners.
Thanks, Tracy. Good afternoon, everyone. I'm very glad to be able to join you at this time that's been so difficult for our staff and our providers and many of the members and families we serve, and it remains, as Tracy said, a very difficult time for many. We as well have accounted for all of our staff. Thank goodness. We still have many staff, though, that are struggling, and we're working hard to support them in understanding what they need and getting them what they need. A big thank you to the department. Kelly, you guys have been fantastic. We are so connected with you and appreciate the support. And I have to extend a very, very special thank you to our peer LME MCOs. VIA and Trillium and Alliance have been supportive. Trillium, your expertise, Cindy Ellers, just really has been game-changing for us. And we thank you for that. I've thought many times in these past few days how blessed we are in this state to have our very unique system of public managed care. And the vision for this system is unfolding exactly as it's supposed to right now, in this moment, in how we at a very local level are partnering with our stakeholders with whom we have long-standing deep relationships, with our providers, our staff pulling together. This is how it's supposed to work. And this is a wonderful, unique thing about our state. And it's comforting in many ways to know that the individuals with the most complex needs and their families and our providers and our staff are being supported in this way in their communities, understanding those local needs. And we will continue to do that. We certainly have not been impacted the way VIA has, but we do have, especially in Burke County, Catawba, Cleveland County, and Rutherford County, were hit particularly hard. And, I have to laugh. We've got staff like VIA with their laptops in tow going to churches and, grocery store parking lots and co-workers' homes for showers and internet, to be able to do the outreach to our members in particular and providers that we've done, very similar to VIA, really understanding where our members are and supporting our TCL members, our innovations members, those with very, very complex medical needs. And that is ongoing. That has been going on all week, all through the weekend, and today, and will continue. That is certainly our first priority, is understanding how we can support our members and making sure that they are safe and have what they need. We are seeing some members having moved and then moved again. So this is not easy work. But we are being successful, and it's important that we make that connection with our members and their families at this time. I do want to say that as we want to thank to our providers who have been extraordinarily supportive to us, to the communities, volunteering to support shelters and the behavioral health needs in particular in those shelters. That's been extraordinary, and we're very grateful. I do want to convey too that for those of you who are connected, our website, Partners website, and VIA's website, and the department's website have very, very good resource information listed on the Helene recovery pages. We update that several times a day as we get more local information about resources and supports that are available to you. Our call center is fully functional. You can call anytime. If you're not able to get on the internet, our access numbers are right here on this slide. But you can call us. Providers can call us. Members can call us. If you've got a question, we can make sure to put you in touch with folks who can help you. We we have seen some providers and members too who have folks and partners who they're used to calling and haven't been able to reach them. So they've called the call center. Absolutely do that. We will track down what you need. And I, again, just want to thank the department for the partnership. And as Tracy said, we are in the early days of this and are so happy for the collaboration to this point, but look forward to it as we go into the coming weeks. A special note as we are thinking about this together, to send our prayers and thoughts to those in Florida who are likely going to experience something similar in the coming days. We know what this is like, and it's difficult, and so we'll be praying for them. Kelly, thank you for having us today.
Thank you so much, Rachel, and thank you, Tracy. Really appreciate hearing from you, but also really appreciate all the work you're doing on the ground with your community, your providers, consumers, just community members. It's been very inspiring to see, and thank you, Tracy, for reminding us that Tracy said it really well, so I want to underscore it, that we are still in response right now. So we're very focused on making sure that we know where folks are and they're getting the immediate help they need. Food, water, medications, a safe place to stay. So we know that many more supports will be needed on an ongoing basis, but that is the priority right now. There's also the larger community priority, restoring water and electricity. We get the updates pretty much when you get the updates, but we understand that those really essential things like water, electricity, water in particular, will really continue to impact practices, providers, and community members in coming days, and will affect kind of ongoing recovery efforts that we are planning now. So I want to end by just highlighting again some of the resources that we've deployed statewide. I mentioned some of these already, but I want to make sure folks know about these. We have been advertising SAMHSA's Disaster Distress Helpline. This isn't our 988 call center. They work very closely with the Disaster Distress Helpline. Sometimes they warm handoff on calls. This is a 24/7 line. This is trained crisis counselors. We've been giving this line out to everybody because we want to make sure that folks have it. And this is a special national hotline, fully staffed with people who help people manage going through a disaster, whether it is you in the disaster, you watching, someone in the chat mentioned survivor's guilt, you watching this, you worried about your family, whatever it is, but this is actually a really good line. So please use it. Next slide. This is a very, very important one as well, the Disability Disaster Hotline. So want to make sure that folks know about this. So this is very much about, so remember that disaster hotline 988 is for anybody. Anybody can have a crisis, right? But the Disability Disaster Hotline is very helpful in providing information, referrals, guidance to people with disabilities and their families during disasters. It's also a 24/7 line, but understanding sometimes people with disabilities have unique needs and are worried about just very specific things and resources in communities. So want to make sure that folks know about this Disability Disaster Hotline as well. Next slide, please. 988 Lifeline. Hopefully folks know about 988. 988 is fully prepared. They've started to see an uptick, but they're fully prepared to meet the needs and to staff as much as they need to. Talks, chat, and text 988 if you're experiencing whatever is a crisis for you. And again, folks we talked about at the beginning about taking care of yourself. And if symptoms persist, please remember that 988 is out there if symptoms persist. And there's no wrong reason to call it. Consumer, provider, state employee, whoever you are. Next slide. Our Peer Warm line is here and ready as well. So encourage folks to use 1-855 Peers NC. They are ready to staff up as needed as well. As of last week, they were supporting some of their affected members who lived in the West, but were fully prepared and supporting the entire state and will continue to do so. Next slide, please. Hope for NC Helpline. Hope for NC Helpline, we are emphasizing as a support for mental health support for first responders, volunteers in the community, clinicians, nurses, social workers, whoever, you are a helper. This is the gist. You're a helper and you need supports as well. So that's what Hope for NC is. It doesn't have the catchiest number, but that's it, 855-587-3463. It is free, confidential, and 24/7. Next slide. Also, if you may have known about the Connections e-recovery app, you may not have known. We had about 500 users. We launched this with Trillium several months ago. It is a recovery app, but one of the coolest features that we like about it is peer staffed all of the time. And this is an app that agencies can use for their members, but now we have opened it up statewide for anyone to sign up. Again, it is staffed with peers at all times, so you can get live support from other users, but it is staffed and moderated by peers who are there to support you. It also has helpful tools for recovery. Again, people are displaced from their treatment and their usual providers right now. We just want to make sure that those stuff in recovery and managing their substance use, and certainly managing this crisis, this disaster, have additional tools ready to them. So if you have a phone, the e-recovery app is available to everyone statewide now. Next slide. So what's next? There's a lot that is next. We're continuing to meet immediate needs. Again, I think Tracy and Rachel really emphasized that. And that's the immediate needs of consumers, providers, and just our communities at large, people who maybe have never been in our treatment, recovery, or supports delivery system, but we need help now and they need help now. So it's all hands-on with immediate response needs. I've run through the things the department is focused on, but also the mental health, substance use, IDD, and TBI supports we're focused on. Please know that we have already started discussing, and we'll really get down in the weeds with VIA in the coming weeks around long-term recovery efforts. So we're organized, we're supporting local efforts as much as we can with funding, policies, flexibility, bringing in as much federal and additional state funding as we can to support long-term recovery in affected communities. I mean long-term, I mean a year, I mean however long it takes. I don't mean we're going to forget about this next week. I want to assure folks on this call that lots of other work continues to happen every day. We're not ignoring the other 75 counties and the needs of people and programs here in North Carolina. It's very much all hands on Helene response right now. But please know that we are continuing the other work we're doing. We'll continue to do that, but we absolutely will continue to support VIA, partners, all the LMEs, the community in the West with long-term recovery as long as it takes. We are asking for additional federal and state funds. Our federal request goes in tomorrow. We have an ask poised to share with the General Assembly for additional funds. And again, the goal is certainly where we need to support statewide commodities like Hope for NC or 988, but the goal is really to get funds locally as much as possible. And a lot of our funds will be things that perhaps Medicaid can't pay for, FEMA can't pay for, additional services for people who are displaced, supports for providers, rebuilding of clinical and therapeutic things that people in communities right need. I don't know what we'll get in terms of funding, but we're asking for it. And we're trying to make sure that we are focused on things that perhaps other funding sources don't necessarily cover, like things that aren't necessarily covered under Medicaid or not necessarily covered under FEMA. So we want to make sure that we're braiding our funds together to be helpful. Also, I mentioned flexibilities. So remember, during COVID, Governor Cooper and Secretary Kinsley got a lot of different flexibilities in place, either through executive order or legislative changes, or even waivers for programs, or like we're putting together federal funding for FEMA and SAMHSA, federal funding request. We're working on all of those things now because we want to make sure that people have all the access they need to services and supports right now, the ones they were getting and the ones that they may need now that they weren't getting before. A couple of things you won't see on the slides, but that come up frequently are things like, we've been asked quite a bit about sustainability payments for providers, extra payments for providers. So for example, we can provide direct support professional supports in shelters, for example, or in temporary group homes if individuals are there. So all those things we are looking at right now, we agree that those are necessary supports. We are just doing all the things we have to do behind the scenes to get the right authority or get approval for our funding. And we'll be sharing those things with you. I can't promise you what all of those things are right now, but know that your requests are being heard. We've learned a lot through COVID. We're picking up a lot of those flexibilities, needs for additional funding. We're working with the federal government, the General Assembly, with the governor's office, SAMHSA, CMS, on all those flexibilities and additional funding. So please stay tuned. We'll do our very best to listen, to advocate for additional things, and to share those things with you as they come on board. One of the things I want to talk about really specifically, just to unpack a wee bit, is we got an interesting question in the chat, I think, that was really to the point, right? It was from a group home that currently didn't have running water and was working on generator power. And so for us right now, here's what we know, because we do know. We've been working with VIA and partners in our team and DHSR. We do know all those facilities that exist, those that are still standing, those that are on generator power or back on electricity, who have running water or don't. We know that. We know how many people are there. And so like right now, we need to know people are safe, have food and water, and some form of electricity. That's what we need to know right now. We also know the people who did not have those things and had to be rehoused, either in a shelter or a temporary hotel. We know that. And we are working collaboratively with the LMEs to find out what a housing stock we have, right? So as we move into recovery, one of the things that will happen and take a while is that people will be moved and rehoused. And I know that's really scary for a lot of people. And group homes and residential facilities are looking for concrete guidance, like when's my water going to come back on? When's my electricity going to come back on? How do I make the call to move people if I'm not going to get water for a while? What happens to my staff and my staff payments? Those are all great questions. Other providers, outpatient providers, are saying, you know, I'm open, but I don't have running water. I'm open, but people can't get to me, so my revenue is going to plummet. So all of those like businessy things are not forgotten in any way. They are just part of recovery. Right now, we're hyper focused on making sure that people are safe and okay, have food and water. That's what we're hyper focused on, right? And their medical needs are met and their medications, right? Just like Tracy said. But other things like where people might have to get rehoused, really concrete guidance to residential providers and group homes, ways providers can get things like hardship payments and sustainability payments, where there are going to be additional flexibilities with policies for things like telehealth or staffing flexibilities, like all that is in the works and will be coming. So look for more guidance on that. I would say a good rule of thumb always is, if you're that provider who wrote in and you're like, you know, I'm on backup generator, don't have running water, I've got however many consumers living at my group home, I don't know how long I can stay. I would encourage you to reach out to VIA, get good guidance from them, right? Because again, you both have the same priority, making sure your staff are accounted for, the consumers, the people living there in that home are accounted for and safe. And they will guide you on what resources and supports that you need now. For folks that are hanging on, and consumers are safe and staff are still able to come in, know that we haven't forgotten about you, and we will be more concrete with guidance, and we'll work incredibly closely with VIA and the partners team to give them whatever institutional support and financial support that we can muster to help. Okay, we are very low on time, so I'm going to check with my team just right quick to see if there's any really big things. I want to make sure that we answer. Katie, are there any big areas that we'd have to, or wait, I might have another slide. Katie, do I have more slides?
I think that's the
Yeah,
end
do
of
I-
your slides.
Do I have any more slides? Okay, very good.
Right.
Katie, were there any big topic questions that we didn't answer? I want to make sure that if there's any other big question. I was trying to watch them, but
Yeah, I think there was one question that came
okay.
through early on that was just asking and identifying a need for people who are living in the trauma. Where can they reach out
Mhm.
to? How do they get in touch with that support that we know is so important?
Yeah, and I would say thank you. Thank you for even asking that question. That's awesome, right? So you're saying I need help or I know someone that needs help. I think that's great. I think there's you can't go wrong calling, you can never go wrong calling 988. You can just call 988. You can also call that disaster response line because again, I think the beauty of the disaster response line and why we do promote it is that line is there 24/7. It's a national line. It's offered to all states via our mental health and substance use authority, so they know what they're talking about. But those are trauma-informed clinicians who are there to help you whatever stage you want. If you're dealing with guilt, you're dealing with loss, you're dealing with anxiety. So I think that disaster hotline is a really good line to use with trained specialists, but you can never go wrong with calling 988. Katie, anything else before we hand it over to Dina?
No, I think we can go ahead and transition it. Thank you
Okay.
all.
I'll say one final thing. I want to say thank you all for joining us today. I really, honestly, I know we shared resources today. We wanted to fill you in on what's happening because I don't know about you, but I don't like it when I don't know what's going on. So we wanted to share with you everything we could share with you in terms of what's going on and kind of forecasting what's coming. But the single biggest reason we wanted to meet today is just to stay connected with you. Just really wanted to stay connected to you. You are our community. We care about you very much. For folks in the West, we very much care about what you're going through. And we want you to know that we're here for you. And we're here for each other. And we're just grateful for whoever could join us today. And we ask you to please stick with us and please keep sending in your ideas, your requests for what's needed. And we're going to do our very best in partnership with VIA partners, all the LMEs, providers, families, and consumers. And we're going to get through this. We are going to get through this together as a community. So thank you so much for joining us today. I thank you to our special guests, the LME CEOs, Tracy, Rachel, Rob, and Joy. Thank you so much for joining us. And thank you for all that you're doing locally in communities. And with that, I'm going to turn things over to Dina to close us out.
Thank you, Kelly. The recording and presentation slides for today's event will be posted on our community engagement training webpage. The links are included in the chat box. There will be a brief survey following today's webinar, and we'd appreciate your time completing it. Our next side-by-side webinar is scheduled for Monday, November 4th from 2 to 3. This concludes our webinar for today. Thank you for attending.